This government meeting is brought to you by Eastworks and our local cable subscribers.
All right, the time is 5:32. Today is February 18th. This is a joint meeting of the Southampton Local School Committee and the Southampton Board of Health. We'll call the Southampton Local School Committee to order. All 5 members of the committee are present. Board of Health.
I'd like to call this meeting to order with the Board of Health and Joint School Committee meeting. Kate Savarese and Caitlin Rooks are both present.
Thank you. I think tonight's agenda, the only item on the agenda is a continued discussion on the school's response pertaining to Governor Baker lifting the mask mandate on February 28th, 2022. We did some initial testimony or hearing on this at our regular scheduled meeting. As a general rule, special meetings of the school committee do not have public comment. However, at last Wednesday's meeting, I indicated that we would have public comment tonight. And I'm going to treat this as a continuation. So when I do open it up for public comment, if you had already spoken last week at the meeting, you will not be recognized to speak this time. This will only be for new individuals that were unable to speak last time on the public comment section. I'm going to share first some survey results that we have. I will pause when I get to the association's results, and I believe Mrs. Hale is here and can speak to those pieces just to get the data out there for everybody. Then we can have the public comment again for only those new individuals, and then we'll have discussion. Also, because this is a special meeting and it relates to COVID, the school committee has a policy to recognize at the table for purposes of discussion one representative from the association, and tonight that is Susan Hale, who will be free to partake in discussion with the committee as we go along, and then at the point that any vote was made or is made, if there is a vote or a motion, that would just be to the committee members. Okay. So the first thing I'm going to share with the audience is a survey that was done by the 6th grade students today and shared with the committee this afternoon. In an effort to empower the student voices to important matters, Mr. Hodgkins asked Norris 6th graders to complete a version of the district survey anonymously this morning as well. I'm sending the results along with your consideration. There were 50 responses. I believe our 6th grade enrollment is 60, so a significant portion. What is the preference regarding current mask policy that requires everyone to be masked? 16%, we should continue to require masking indoors for all individuals, regardless of whether or not the state of Massachusetts continues to require masks. 62% said we should remove the mask policy and make mask wearing optional for all individuals. 22% do not feel strongly either way and would be comfortable with either decision. This was a 2-question survey. The second question was, if the mask policy was removed and wearing, somebody needs to mute themselves. If the mask policy was removed and wearing masks was made optional, would you still wear a mask at school? 17.6% said yes, 49% said no, and 33.3% were unsure. Again, that's the 6th graders. Now we have the district survey. The district survey will be presented in 2 pieces because they, on the survey you were asked to identify as either a parent or a staff member. First, it is the parents. This is the mass survey. This was based on results that were received up until 12:30 this afternoon. Anybody that responded after 12:30 is not included in these results. 219 parents think that Norris should remove the mask policy and make mask wearing optional for all individuals. 99 parents think Norris should continue to require masking indoors for all individuals, regardless of whether or not DESE continues to require masks. 29 parents do not feel strongly either way and would be comfortable with either decision. There's a total of 347 parents that responded to the survey. Parents only, if the mask policy was removed, would you or your student still wear a mask at school? 25% unsure, 52.6% no, 22.4% yes. Now the same survey, but this time isolating out those that identified themselves as staff at Norris. There were 52 responses. 23 staff members believe Norris should remove the mask policy and make mask wearing optional for all individuals. 20 staff members think Norris should continue to require masking indoor for all individuals, regardless of whether or not DESE continues to require masks. 10 staff members do not feel strongly either way and would be comfortable with either decision this includes. Second question, if the mask policy was removed, would you or your students still wear a mask at school? 20 staff members said no, 23 staff members said yes, 9 staff members said unsure. Susan, do you want me to share the STA results, or do you want to share them and go over them?
No, you're welcome to. Thank you.
Okay. I'm just going to go right down, just read them. I
Okay.
will, there are, as in with both surveys, there were spots where people could do comments. I'm only going to report on the statistical data, not the comments.
Okay.
The STA, this is an STA survey that was done in February of 2022, I believe either earlier this week or late last week.
Mhm.
Should the Southampton School Committee delay changing the mask policy? There were 55 responses. 34.5% said no, 65.5% said yes. Next question, if masks become optional, do you think the Southampton School Committee should implement additional mitigation strategies? 57.4% said yes, 42.6% said no. Do you think masks should remain mandatory until the youngest learners have had the option to be vaccinated? That would apply to those 4 and under. 57.4% said yes, 42.6% said no. I believe that's the last question. Those are the data points that we have. I know, Stephanie, do you want to share the data points that you provided? I mean, I can share them on the screen, but do you want to talk about them?
Sure, that would be great if you wouldn't mind putting them up so people can visualize what I'm talking about.
Okay.
Okay, so the chart here is broken down by grade level, the percent vaccinated in each grade. And then there is a student total. So our entire student population, we have 230 students fully vaccinated, which is 48.83% of the student body. And out of 87 staff members, we have 82 vaccinated, which is 94.25% of our staff. Combined, that is a 55.91% combined fully vaccinated total. I did also just look at preschool by age, because as we know, those under 5 are not eligible for vaccination. And so currently our preschool, of that 37 listed there for enrollment, only 7 of them are actually eligible right now for vaccination. So I further broke down the percent vaccinated by eligibility. And when looking at just students, it's 52.15%, and our combined population is 59.09%. The next numbers are quite astounding to look at. In the last 90 days, the Norris school community has had 13 positive staff members. 12 of those individuals were vaccinated and 1 was unvaccinated. We had 130 students test positive in the last 90 days. And I broke this down by at the time of infection, because some of these kids are fully vaccinated now, but when they actually transmitted COVID, they were not fully vaccinated. So at the time of infection, 28 were vaccinated, 13 had had 1 dose, 3 had 2 doses of vaccine, but were not yet fully vaccinated because they were not 2 weeks out from that final dose. And 86 of these students were unvaccinated. And I did also just want to note again that 7 of those unvaccinated were not yet eligible to be vaccinated. Then moving down to our weekly COVID safety checks, we continue to have pool testing at Norris every Tuesday. We are currently at 54.12% participating, though it is, important to note that, those 130 students and 13 staff that we were just talking about are not eligible to participate right now. So that's about, 25% of the Norris population that until that 90-day window is up should not be participating in pool testing. And then we now have the at-home rapid antigen test from DESE as a second weekly safety check. And we have about 41.04% staff and student combined participating. To date, we have identified 15 positive individuals through the pool testing program. And this week, we had no new positives identified from pool testing. The inventory that we listed here was really just to kind of give people a sense of, if there is a need from staff or students to have more effective masks moving forward, if that's something that they're having trouble accessing. This is sort of what the stock looks like at the school in terms of masks. Also home tests, the town generously donated some tests to us, as well as Hilltown Community Health Center. So right now we have 585 at-home test kits that we can provide to families or staff that are having difficulty accessing a test, whether it be for symptomatic individuals to return, or if somebody's been determined to be a close contact, outside of school and they're not vaccinated, they could use one of these tests as proof of their negative to return to school.
Okay. Are there any questions for Stephanie on what's been presented so far? After we go through whatever public comment we have, we'll come back and ask for recommendations. Any committee member or anybody, Caitlin, anyone on your side have any questions?
No, thank you.
Okay. Okay, so that's all the data points that I believe that we have. I will say that the committee itself has received probably 3 or 4 dozen worth of communications and emails that have all been read. We're going to pause here and continue the public comment section. Again, this is a continuation of our public comment session from last week. We've already heard from 1, 2, 3, 4, 5, 6, 7, 8 individuals. If there's any individual that did not speak last week that wants to speak this week, you need to identify yourself via the text chat box to myself. I'll call on you in the order in which you enter in there. And this is for new folks only. We'll allocate 15 minutes to this if we need it. Okay, first person to speak is going to be Bob Barkham.
You're on.
Hey, everybody, how you doing tonight? With recent input from our officials clearly indicates that our schools are safe. Advances that we've made, such as lower case counts, dropping test and stay, dropped contact tracing, and reducing quarantine times, we're all accomplished with most people wearing cloth masks, which the CDC says barely better than wearing no mask at all. If we made all those advances with the use of ineffective masks, then we can justify then how can we justify needing masks at all? Many would point to vaccination rate as a critical factor. However, per the CDC on July 27th, the vaccine is not a key factor in preventing spread. Instead, as Stephanie can confirm, it is primarily reducing symptoms and duration. If it's not affecting the spread, how can it be an important variable in deciding when to remove masks? So to repeat, according to Stephanie, the only difference between a vaccinated and an unvaccinated person that could possibly affect someone else in the community is that the duration of their symptoms could be 2 days longer. However, if this is not a significant issue, because the recovering person will come back to school won't come back to school until symptoms subside. And even when they do come back, they will be masked regardless of their vax status. If we believe masks work, isn't that adequate? The last issue on vaccines is fear for those too young to be vaccinated. Parents, teachers, and students who responded to the survey had the opportunity to consider if they were concerned for their children or siblings under the age of 5, and their vote clearly reflects their level of faith that our schools are safe. Earlier this week, Stephanie made an important point that if we don't make masks optional now, it will only be harder to remove later. The same goes for swapping one mitigation strategy for another. That continues to feed the fear rather than letting kids begin to heal from their intense and possibly unfounded anxiety. If a person were using cutting or alcohol as a coping mechanism, we would not encourage or force them to continue coping that way. Instead, we would encourage healthier options. There's a difference between being safe by saying optional masking and being terrified by insisting everyone else must mask too. I've heard it said that the kids are tolerating the masks well. To tolerate something means to endure it. The dictionary definition of endure is to suffer patiently. To suffer patiently? How are we okay with that? Anyone with a concern about their personal safety can continue to wear a mask if that is what they and their families want, and they can feel fully protected by doing so. No one's mask is one directional. Any mask that can keep germs in can also keep germs out. That means a person wearing a properly fitted, high quality mask is protected, regardless of what other people are or are not wearing. In review, the vax rate does not have an effect on community spread. The masks are not necessary to protect the vulnerable, and anyone can wear a quality mask. So to the school committee, I am respectfully asking you to approve optional masking as of February 28th. If the townwide mandate overshadows you, so be it, but vote it in tonight anyways. This way, proper preparation can be made for implementation so that as soon as the town's mandate is lifted, our school community will immediately have options. To the Board of Health here tonight, all of this applies to you as well. We focus so heavily on masks that we're not acknowledging other advancements such as readily accessible vaccines and boosters for those who want them, early effective treatments, readily available rapid tests, and high quality masks. In our conversations, your primary concern was overwhelmed hospitals. The president of Bay State was on the news yesterday and considers this resolved. The secondary concern was the big why. DESE gives us permission to have optional masking in our classrooms. If we can be unmasked in classrooms where we have sizable groups for long periods of time, how can we justify not having optional masking in public spaces where we are more like ships passing in the night? A close contact is defined as being within 6 feet of a person for 15 minutes or more in a 24-hour period. The big why, and nearly all of our other community spaces are not crowded, nor are these places where we would be near one another for enough length of time to be close contact. Low likelihood of being a close contact means low risk. This makes masks less relevant, and they are even more less relevant when we acknowledge that a huge percentage of wearing are wearing ineffective masks or wearing them in an ineffective way or using them to gain a false sense of security and ignoring other precautions. The Department of Public Health is no longer recommending widespread indoor mandates. Prolonging townwide mandated masks in the face of all this erodes faith in your credibility. You have the authority and the ability to vote tonight to end the townwide mandate here and now. Please do so. Thank you.
Thank you. Troy Chilson.
Okay, you can hear me?
Yep.
All right, thank you very much. My name is Troy Chilson. I'm a local physician assistant. I have something I'm going to read to you here. I'm a local physician assistant with almost 3 children in Norris School. I live on Gilbert Road in Southampton. I'm writing to you in light of Governor Baker and DESE's address to the state of Massachusetts. As you know, they lifted the global masking mandate, and together we need to move forward with what we believe is the best for our community. I would like to acknowledge that we are all scared or have been scared at one time by SARS-CoV-2. I think we can all find common ground. I don't believe any of us wants to see anyone injured by the virus or the vaccine. We also have to keep in mind the effects these mandates have on our children's development and mental health. I personally believe that masking children who have a 0.01% chance or less of a catastrophic event from COVID-19 is cruel. They are simply not at high risk. At best, from the literature I have seen, there's a 15% reduction in the chance of getting the coronavirus with a medical grade mask, which is marginal protection at best. I don't believe the benefit of masking outweighs the risk of our children's development. Virus particles can enter the mask at the very least on the side of the mask, not affixed to your face. The kids all touch their mask many times a day, and who knows what else they are breathing in. Using a KN95 mask is not a realistic option due to fit testing, and they are considered a respirator. Our children need to see each other's faces, including the teacher, for the development of interpersonal skills. There has been an increase in speech referrals of 364% in some clinics for babies and toddlers due to masking. I provided a link. Forbes deleted an article by an educational expert, it was false information, they were saying. The expert asserted that forcing children to wear masks causes psychological trauma. I quote from the article: neurological research demonstrates that kids who experience this kind of fear and trauma at a young age undergo structural and functional restructuring of their brain's prefrontal cortex, resulting in emotional and cognitive processing problems. Students in most American classrooms now must wear a covering over their face and stay distanced from their peers the entire school day. Kids can't see each other's smiles or learn critically important social or verbal skills. End quote. I have a daughter on an IEP. She is dyslexic and hard of hearing in one ear. I do believe that masking is not helping her with her disabilities, as talking through a mask is muffled at best, and a child is unable to read a teacher's lips. She cries every day on the way to school, and it is heartbreaking. I do believe that unmasking will help her to understand the tasks she is given on a daily basis. I wasn't going to talk about the vaccine, but many parents have cited our low vaccine rate as a reason to mask our low-risk children. I would like to write to protect my children from the vaccine. Why? First of all, mRNA technology is new. We do not know the 5 to 10 year and beyond potential side effects or complications. Those complications are being censored as we speak. The dosing schedule is 2 doses, not just 1. The risk of peri and myocarditis increases with the 2nd dose. Peri and myocarditis is more common in males who get the Moderna vaccine. Pfizer is in court to release their clinical data, to not release their clinical data for 75 years. I don't know what they have to hide. I will not give my children multiple doses of a vaccine that can damage their heart for a condition they have a 99.99% survival rate for. The other issue here is that the vaccine does not stop transmission. When you get the vaccine, it protects you, the high-risk patient, not the rest of the world. This notion that one is selfish or does not care about anyone else is false propaganda. My child's vaccine is not going to protect her teacher or her grandfather. It is not the unvaccinated's job to protect the vaccinated. That's the vaccine's job. In real medicine that follows real science, you have to do a risk-benefit analysis. With COVID-19, the science is get the vaccine, you're good. Don't get the vaccine, you're bad. They don't care about your age or risk level. They don't care if you have recovered from COVID and have natural immunity, which has been shown to be more powerful. In real science, we recognize natural immunity. Medicine and big pharma are corrupt, and if you do not believe so, I have an EpiPen to sell you marked up 300% from a single dose. Pfizer made $54 billion in 2021 off our free vaccine, a 40% increase from the previous year, and they are not done yet. Currently, they are trying to get the data to inoculate our 6-month-old through 5-year-olds with 2 doses and a booster, and these children are low risk, and Pfizer does not want to release their data to the public. The coronavirus has been the greatest transfer of wealth in human history. Parents at last week's meeting also accused other parents of using misinformation. I believe this information to be the missing information. Why do we label speech we don't like as misinformation? Because it threatens the narrative or propaganda. Somewhere between the propaganda and the missing information is the truth. If you do not have dialogue about both and just label information you don't agree with as misinformation, you will never have truth. Last week, I also heard members of the committee talking about involving other institutions such as the Board of Health for final decision-making. I'm not opposed to phoning a friend. The only issue with the friend is all you have to do to know how they feel is to walk around the town of Southampton. They are pro-mask. Upon entering any store in Southampton, a sign on each door says mask mandated by the Board of Health. I recall how heavily the school committee relied on Governor Baker and DESE's mandates. I hope you rely as heavily on these governing bodies with their current recommendations. DESE and Governor Baker have assessed the data and spoken to the scientists in the state to make their conclusions. Free our children from masks and social distancing, allow them to be kids again. Anyone who wants a vaccine, both children and staff, has plenty of time to do so and have done so. They are protected. We support anyone who wants to continue to wear a mask. Let's start protecting the people who do not want these totalitarian one-size-fits-all mandates for little people with the lowest risk in our society. Coming together means freedom of choice for each family. It is time for all those who are fed up to stand up strong and speak up to free our children's smiles. If the majority of parents and teachers want masks and multiple vaccines for our children, then it is truly me who is in the wrong community. Thank you for your time.
Thank you. That only leaves 2 minutes left in public comment. We'll recognize Jillian Marie, but I warn you, you only have 2 minutes left before public comment ends. Janelle, I saw your screen pop up, but you're muted if you're trying to talk to us. Okay. There's 1 minute left. Adam Cefalo, Cefalo.
Yes, hi, can you hear me?
Yep, go ahead, Adam.
I just want to thank the 2 people previously for their information. I think it was very important to get that out. I would just, if I know I have 2 minutes, let me just take one quick moment and say that, the misinformation, disinformation story is just tedious. We were told that masks work. We now know clearly that most masks are garbage and that they do not work, and that story was untrue. We were told that vaccines would work and prevent death, transmission, and contraction. We now know that you can die, you can transmit it, and you will contract it. So that story was untrue as well. I do know that as of yesterday, the CDC has taken away the quote unquote fully vaccinated label, because there is now a 4th booster that people might take. And to say that anyone is fully vaccinated is just totally silly. And that's why the CDC has taken it out. Also, if you just look at the total number of deaths of children under I believe it's 18 to 21, the number is around 800, maybe it's 1,000 now. But to my knowledge, all of those children who did die were suffering from comorbidities, and it wasn't from COVID by itself. I think if we're going to follow the science and not the political science, we need to make this change just as Desi has suggested. It's time to unmask our children, take a look at the carbon dioxide intake of children wearing masks for 2 years now. And if you really do care about the science and our kids, it's time to take the masks off. Thank you very much.
Thank you. Time is 6:02. Public comment time has expired. During the public comment time, one
Can I make
question.
one comment, please?
No,
Yes,
no.
I was
I
denied.
will remove you from the meeting. This is going to be organized. Public comment has ended. One question came in during public.
Excuse me, I have a
The question-
question as well. If more
Excuse
people,
me.
if more people want to speak and we run out of time, how do the rest of the public,
Give me a minute to change.
how do the rest
security
of the public
settings.
express their sentiments? If they're not given the time to do so, how do we do that? That's my question.
Okay. We will now unmute people when they need to be recognized to speak. A question that came in was, if a child is out of COVID protocol, is it counted positive on the gathered statistics? I posed that question to Stephanie, and Stephanie's answer was, if a child, I find it. No, only a confirmed positive case. So now at this point in time during the meeting, we're going to go to discussion amongst the committee members, the Board of Health members, and the STA representative. So I'm going to select on each one of you and ask you to unmute yourself, and if you remain unmuted, so that we can have an open discussion. I think I'm missing one Board of Health member.
Kate Savarese.
Savarese. Okay. Discussion?
Can you unmute? Allison's not unmuted. Neither is Dr. Bonneville.
I missed it and it disappeared, sorry.
That's okay.
I'd like to hear from Susan Hale about what the STA's information and what their survey said, if she could we'd like to hear what the thoughts are on the STA survey. It's a little bit different than the joint survey with parents. So, but it was very much looked like in support of continuing masking.
Yeah, I can speak about that. Elizabeth, our president, is currently traveling, so I'm speaking tonight. And she wrote a survey that we sent out to all of our current union members, and most of them answered. And yes, teachers and staff at this point have some strong concerns about the date being the day after February vacation. And I think overwhelmingly, we know that dropping masks is coming, but we do have concerns that it's coming right after a vacation. And, before things like St. Patrick's Day and whatnot. And we were really hoping that instead of February 28th, that the committee might consider waiting until March 28th.
Thank you.
Okay.
Other discussion? So the other observation that's come to light in the past couple of weeks that I'll just share, and then we can discuss it one way or the other, but within our district of the 5 towns, each town kind of handled this response a little differently, but specifically to Southampton, right? Once Desi put the mandate in place, we put the mandate in place. And then a few weeks later, the Board of Health followed suit and did the mandate throughout the town. Desi has repealed theirs. If we repeal ours, we still fall under the Board of Health mandate. At least that's the legal opinion we have from council.
And I will just mention that we are having a meeting on the 22nd to discuss the mask mandate.
Is the discussion going to be around whether or not it's going to coincide with the 28th or sometime in March or some sort of
Correct.
That's February 20, what was it, February 22nd?
22nd. On Tuesday, correct.
Okay.
So I just put together a couple of comments and I'm happy to speak a little bit. I understand that the masking issue is completely split. I understand why people are frustrated, right? We thought we were going to have 2 vaccines. Now we're hearing about a 4th vaccine. And governing agencies at this point, the World Health Organization, CDC, state and federal government are all providing different and slightly conflicting information. So it's really no surprise that the public is really conflicted about what is right for the children. Reading the CDC article about how cloth masks are far less effective, of course, is really frustrating. And it's frustrating for parents too, including myself, who purchased a large collection of cloth masks for my 4-year-old child. I think it's important to acknowledge people's concerns, the teachers' concerns, the preschoolers who are unable to get vaccinated, and recognize that people should be able to make a choice to continue masking, and that families and parents really should support and welcome masking. I understand that there was some protesting outside of the school this morning against masking, and I really feel like that creates a conflicting message for the children who want to make the choice to continue masking. I really believe that every single parent has the responsibility to work together as a school community to minimize disruption to children's classroom time, which will ultimately help things get back to normal, right? Whatever that timeline might be, I think everybody needs to have a commitment, whether you believe that masking should continue or not continue. I think I agree that the timing is really tough to remove the mask mandate right after a school vacation when people are going to be traveling. But I really feel like families can make a difference in helping to keep the school community safe, regardless of whatever date is decided at tonight's meeting. And just some examples that I thought about was, a family member's decision to wear a mask at an airport or in a crowded event. COVID testing your family members before coming back into school after going to Disney, right? The school vacation. Choosing to mask your unvaccinated child. And I will say that DPH is continuing to recommend masking for children who are unvaccinated, right? Which does encompass a large portion of the Norris school community. I think people opting into the school testing program and using the at-home test each week. I mean, we have these great tools from the state government that people just don't want to utilize. And even if you don't believe in masking and continuing masking, participating in these interventions really can help to make the school community safer. Not sending your kid to school sick, reporting COVID cases so effective contact tracing can continue outside of the school environment. I think the number one is promoting a culture where kids can decide and families can decide to continue masking, where it's okay and accepted. I really do have a sincere concern about families sending their children in. So say the school committee does decide to make the mask mandate continue until March 28th or whatever date. I really feel that tasking the teachers and school administration with having to be the mask police ultimately affects every child's school experience and takes away from their education time. And I really feel like we're all here because we have a commitment to our community and are truly invested in what's best for our community. And I feel like part of everybody being responsible and doing their part as a community member is recognizing that, we're all here to support the school community and make the best decision for everybody that's here. And despite disagreement, none of us are here to spite anybody else, and we're all here to have a robust discussion and do what's best for everybody. And right now it's really hard to decide what the right answer is because there is no one right answer. So case rates in Hampshire County are still one of the highest in the state. We're actually the red spot in the state right now. The entire country except for Maryland right now is still in a high rate of transmission. Just a week or two ago, hospitalization numbers across Bay State Health System were actually comparable to March 2020 and last year's holiday season. And, we have come a long way, right? We do have widely available vaccines. We do have masks that are available to people who want to wear them. But despite the fact that everybody is done with this pandemic, the pandemic just is not done yet, right? And so we need to acknowledge that perhaps taking some conservative or taking some protective measures, at least over the next few weeks, might help to reduce cases. And the only way that we're going to move from a pandemic into an endemic is to reduce the number of cases and spikes in hospitalization. I think every parent here, every family member, every teacher has a personal responsibility to help us move into the next phase of this pandemic. And I'm happy to answer any other questions about case numbers, but I'm really happy to report that cases over Christmas, when we re-implemented the mask mandate, were 80, which quickly climbed to over 200. Last week, we were about 20 cases, and this is reported PCR tests, not rapid antigen tests, unless the person called their case into the Board of Health, which most families, of course, are not doing at this point. This past week, our case rate was 7, which is really impressive, and it shows how far we've come, even just in the past few weeks. And hopefully with the warmer weather, we'll continue to see a decline in cases just as we did last year. But, you know, of course, I just go back to that personal responsibility of taking precautions when you're traveling, you know, avoiding big gatherings, staying home when you're sick. I think everybody can play their own small part in making this pandemic, you know, history, and moving on to the next phase and helping kids get back to a normal state.
Thank you for all that info. Thank you.
And I'm not calling on you to ask anything, but Eliza, do you want to comment as a principal, or Dr. Bounville, do you want to comment before we go to Stephanie for what I'm sure will be a recommendation one way or the other?
No, I'll wait till after Stephanie. I've been supporting her thoughts in the past week in regards to her recommendations.
Okay. All right. Stephanie, what do you have for us?
Thank you, John. So I did prepare something to read. Before I go there, though, I just wanted to comment on a few things that have been said. I know, you know, a lot of talk of cloth masks being ineffective after the CDC study came out in early February. And, you know, it did not have statistically significant results for the cloth mask reduction that they saw. But I just want to point out that, you know, even in their narrative of the study, they list at least 8 limitations, you know, things like other preventative behaviors people may have not been adhering to, like physical distancing. They don't know the duration of exposures. They don't know if people were wearing masks correctly. If they were cloth masks, what type of fabric was it? How many layers of fabric was it? This data was also collected before Omicron really exploded. So, you know, while it is important to take the results that they got into consideration, we also need to consider that all of the information is not there to really give us good results and trust that cloth masks do nothing. You know, I don't think there's enough there to truly say that. Also, just to clarify, a KN95 mask does not need to be fit tested. N95 masks do. They're considered a respirator. OSHA does not consider a KN95 mask a negative pressure respirator, and it's not certified by NEOSH. And so I just wanted to kind of make that clear, because I think, you know, we are ultimately heading to a place of optional masking. And for those that want to have a more effective mask, you know, that is an option for you without having to be fit tested. And then, you know, in terms of a vaccine, I really appreciate that people have been carefully listening to what I've been saying over the week. And, you know, while vaccine does decrease symptoms in individuals who are vaccinated, reduce the chance of hospitalization and death, you know, it does also decrease the duration of illness in most that are vaccinated. You know, it does not entirely prevent it, but I think it is safe to say that it does help to reduce transmission, and even a small reduction in transmission of the virus means fewer opportunities for it to mutate. Fewer opportunities to mutate means less opportunities for variants of concern like Omicron to emerge. So I just wanted to clarify and make those points about things that have been said. And now I'll get on to my recommendation. So I want to start with a quick note of thanks. Thank you to all of the school committee members and to our school administration. You have been incredibly thoughtful with each difficult decision that has come your way in response to the COVID-19 pandemic. Your dedication to your students and your community is appreciated. Thank you to all of our staff and families that have shared your preference with us on how to move forward with masking. This is a decision that impacts the entire community, and everybody's perspective should be considered. Throughout the pandemic, masking has been a helpful community health tool used to reduce transmission and a mitigation strategy that until now has been required by the state. Commissioner Riley and Governor Baker emphasized that high vaccination rates across the state and testing capacity are some of the factors that led them to this decision to end the mask mandate in schools at the end of the month. I shared earlier the vaccination percentages for Norris. I'll just remind you here, 55.91% of the combined staff and student percentage for the school. There's also, if we exclude our pre-K kids less than 5, we're looking at a combined total of 59.09%. In addition, we talked about 130 students and 13 staff have tested positive for COVID in the last 90 days, 87 of these unvaccinated. How quickly natural immunity wanes will vary from person to person, but this is a contributing factor in our school's protection against the virus. While our vaccination rate is not where I hoped it would be at this time, these recent unvaccinated cases translate to an additional 15.59% of the Norris community with some degree of natural immunity. We have to consider that some of our preschool population is not yet eligible for vaccination, and these families have not been allowed the same opportunity as the rest of the community. It is not yet known if these children will need 2 or 3 doses. We anticipate having that data available in early April. Even if the data is promising, there is still an approval process that takes some time, as well as the time it will take for the child to complete the series. Once emergency use is approved, we do not know how many families plan to vaccinate. In the meantime, I do not think we base a decision for our entire school community on one portion of the population. As a mother of 2 children under 5, I sympathize with these families, and I look forward to the day when we can host a vaccine clinic that all of our preschool students can be invited to join. In terms of testing, we talked about our COVID safety checks, PCR pooled testing that is done every Tuesday with 54.12% participating. Our at-home rapid antigen test is a second weekly check where we have 41.04% participating. We did send one of these home tests with every student and every staff member in the district this week. While using this test is completely optional, our hope is that school community members will administer the test on February 27th before returning to school. As we mentioned when reviewing our supply, we also have a supply of home tests for any families, staff, or students that are having difficulty accessing a test. This could be for those individuals that are symptomatic or those that are not vaccinated and determined to be a close contact to someone outside of school. Every week that passes, we are seeing improved community health data. Cases in Southampton continue to decrease. Our school numbers continue to decrease as well. Over the last 3 weeks, we have had 3 to 4 cases each week, down from 20 cases over a holiday break and the few weeks following. I have also considered that we don't know how masking will impact our youngest learners in verbal development or their ability to recognize and infer emotions based on facial expressions. We do not know the totality of the damage that has been done to our students in terms of social emotional learning and development. We have an uncertain future ahead and cannot predict if another surge will be seen. It will be important, as it always has been, to continue to watch the data to guide decisions and consider possible changes to our practices. Other schools have removed masks temporarily, but then required them again based on case numbers. If the school committee votes to remove this policy, we could absolutely do the same if needed. School and district administration would look specifically at the number of COVID cases in our school to determine when and if that is appropriate. There were a number of comments wanting to see the vaccination rate higher before rescinding the policy. While vaccination does not prevent transmission, it is indisputable that vaccination does provide a degree of individual level and population level risk reduction. That said, even our 5 to 11-year-old population have been eligible for months now, and unfortunately, I do not think we will have a significant increase in vaccination anytime soon. When I consider all of these factors, I feel that based on the downward trend that we are seeing in COVID cases, our accessibility to surveillance and symptomatic testing, our vaccination rate coupled with natural immunity from recent infection, and the availability of high-quality masks that protect the wearer, I would support the decision to remove the mask policy at Norris and make masking optional for all community members on Monday, March 21st. This will allow time to watch for any rise in cases resulting from gatherings or travel over vacation, to continue to watch the data for Southampton to make sure we stay stable or continue to decrease. Similarly, it will allow us to watch how optional masking impacts other schools across the state as many move in that direction on February 28th. Schools have not been determined to be a place where there is high risk of transmission. However, everyone has been required to wear a mask, and we do not know if changing that variable will impact the risk. As we enter more spring-like weather, this timing will allow for more time spent outdoors and increased ventilation with windows being open. And lastly, this would keep Norris on a schedule consistent with the 2 other district elementary schools that have voted to rescind their policy thus far. If you choose to rescind the policy sooner, I would discourage you from choosing a date before Monday, March 7th. While many individuals will embrace this change, there are others who feel worried and anxious about this impending change. This will allow time for families to process what is coming. It will allow time for the school to communicate with families and students, as well as set norms and expectations with students about respecting others' choices. I want to emphasize that revoking the mask policy translates to less masking and not simply no masks. If the policy is rescinded, masks must still be worn by all individuals riding the bus per federal order, by school nurses and anyone entering the health office, regardless of the reason for the visit, by individuals returning to school after COVID infection, and asymptomatic unvaccinated individuals that have been identified as a close contact outside of school, returning to school on day 6 through day 10. Masks will still be strongly recommended for unvaccinated individuals, as well as individuals returning to school with symptoms. So they have provided a negative COVID test, symptoms have improved but not resolved, and they have been without a fever for at least 24 hours. And of course, masks may be worn by anyone that makes a personal choice to wear them. All other existing mitigation measures that we have in place, encouraging good hand hygiene, physical distancing, staying home when sick, testing for any symptoms, biweekly surveillance testing, optimizing ventilation, and encouraging vaccinations will continue. Unvaccinated close contacts that are exposed outside of school will still be required to test and quarantine per the district protocol. It is also important to note that if it is the decision of the school committee to make masks optional, we would encourage and support each individual to make the choice that is right for them based on their individual circumstances. Thank you for your time and consideration.
Thank you.
And I apologize, you can probably hear my 2 children under 5 yelling upstairs.
No problem. What's the will of the committee, or do we have more questions, more discussion?
Did Dr. Bonneville have anything to say?
Thought you were going to get away with it, didn't you?
No, I just recognize that this is a really difficult decision and a difficult position that all the school committee members are on. And I respect the varying viewpoints everybody has. Everybody's being really respectful. I definitely support Stephanie in her recommendation. I'm not a medical expert. I am a parent. I had COVID last week, so I know, and I've been vaccinated. I just, I'm with you here to make a difficult decision, and I'm here to support you. That's all.
Okay. And I'm sensing there is a motion coming. So before anybody does that, Susan Hale, Mrs. Hale, do you have anything else you want to add or?
The union's only concern about the date of March 21st is, I guess, anticipating whether or not that week we have conferences, whether or not they're going to be in person, because we had a number of staff members that were concerned that if they were in person and the mask mandate was dropped, that teachers would be exposed to parents coming into their classrooms every 15 minutes for 4 hours unmasked. That was a real concern that people had. And I know that decision hasn't been made yet, but that was something that was really on people's minds.
That's a fair point.
It is fair. Has that been addressed at the other school committees as far as the timeline? Because I know Williamsburg and there's 2 elementary schools that have voted for 321.
Yeah, but I believe Norris is the only school that remains closed to the public.
Okay.
So it wouldn't have been, it's not a topic for them.
So I imagined that, we would.
But if they're dropping for 321, right? So if they're dropping for 321 and then they have school conferences after and they're not closed to the public, have
It
they
would be in
addressed
person.
it? Right. So if they have in person, I don't know if they've addressed visitors visiting, but that may be a topic for us at our next meeting, potentially too, in March.
Austin, were you trying to say something?
Yeah, can you hear me okay?
Yep.
Okay. Just in trying to think through this and reading all of your letters, and I will say that as far as I observed, I wasn't there the whole time, but I observed, when I went for a drop off this morning, parents engaging in peaceful assembly. I didn't, as far as the couple minutes I was there, I didn't see anything that I would flag as inappropriate, but rather just people expressing their views, which is a sacred right in this country that a lot have fought for. And so I used it as a teachable moment because my child asked, why are they holding those signs? Why does that parent look so angry? And so I was able to talk about that and how, that's something that we're allowed to do, and we're allowed to stand up for what we believe in as long as we're peaceful and respectful. So I appreciated that from the community. In thinking through these decisions, I was thinking that, the masking mandate is going to go away at some point. And so we're not really talking about if, we're talking about when. And one of the things that I was thinking through is, people have various opinions about the timeline, specifically the February break. So I wanted to have more of a sense of what that meant for our community. So thankfully, our interim superintendent last year was emailing weekly reports with data. So it was very easy to get my hands on this information. And as far as I can tell, after February break, the case counts went down, not up. And that, especially in our school community. So for example, there were 2 new cases in our school community. The break was on February 15th to February 19th. On February 26th, there were 2 new cases in our school community. March 4th, 2 new cases. March 11th, 1 new case. And then March 18th, 0 new cases. So it went down, which is good news. And it kind of, our county also went down at that point and lasted through most of the summer, which is excellent news. So I hope that that's the train that we're boarding now. And that came amidst, the summer was when a lot of the restrictions in the general community were being relaxed. And so it seems like that, did do bumps in the numbers, but it wasn't necessarily catastrophic. So I thought that was an important data point that I wanted to share as we're considering that. I also had concerns about the removing more than one restriction at once. So I would favor a motion that's considering only removing one mitigation strategy at this time. And then as we know what the effect of that is, we can work on relaxing other mitigation strategies. Because then we know what's what, and it'll be more clear, the picture will be more clear as to which mitigation strategy had the most effect, if any. And then hopefully we're working towards a progressive approach that can get us to relax things for good and not have to go backwards, because that's the last thing any of us want. Most of all, the people that are, the little people that are lobbying me within my own household. So I guess that's where I'll stop there.
Okay. I'm going to break with normal protocol, and I'm actually going to make a motion from the chair. So I motion to remove the Southampton School Committee mask mandate as of Monday, February 28th, 2022 at 6 a.m. On this date, students and staff will no longer be required to wear masks in the building during school hours. However, any member of the Norris community that prefers to continue to wear a mask is free to do so. In addition, any mandate in place by the local Board of Health shall be followed. If the mandate is past February 28th, masks will remain at Norris. Norris shall remain closed to the public until April 1st, 2022. This topic will be discussed during the March regular school committee meeting. Is there a second?
I'll second.
Motion made and seconded. Discussion?
Discussion is, I think, why are we not staying with Stephanie's date to be consistent with the other elementary schools? I think when we look at the numbers from last year, we did see a decrease, and it decreased by what Austin said was March 18th. This is in a different variant that's more transmissible and has been more transmissible towards children. So I'm worried about not holding and jumping too soon. While I do want to remove the mask mandate, I think that we should ease with caution and follow what the other elementary schools and what Stephanie and the administration is recommending. So I would be for amending that to the date that Stephanie Foss is recommending for March 21st.
I hear with the other elementary schools, but that's with the two within our district. Other elementary schools all around the area are dropping it left and right on the 28th. It's not like we're doing this on a whim on our own. I think we've all really looked into it as well. And with the we did have a decrease last year, not an increase. And I think the fact that we have more testing than we had last year available, and a lot more other strategies in place than we did last year, that it is the right call.
I think if we had a higher pooled testing participation rate, I'd feel much better about that. I think our pooled testing rate is too low. I'd like to see closer to 80% pooled testing. I even think probably there's a lot more overlap between those who are vaccinated and pooled testing than those who are unvaccinated and pooled testing. And I'd love those numbers, but I didn't ask for them, but next time. But that would be what I'd wager. I just think that we want to get to a place where this number continues to go down. Our county looks different than Boston area counties. So I think that, and we have a whole population of unvaccinated children who have not even had access to a vaccine, 30 children. So I'm for lifting the mask mandate. I think we should stay consistent with the other elementary schools in our district for March 21st. And I feel very strongly about that.
So just my feedback on that is, I honestly don't know about Williamsburg, but West Hampton is not under a mandate from their Board of Health. The Board of Health in West Hampton has exempted the schools to free to do whatever they want to do. So when they lift the mandate, it's done. We have a backstop because our Board of Health issued a mandate and not an advisory. I'm a bean counter. This isn't my area of expertise. The DESI says we don't need to do it. I'm happy to, and it really, I'm sorry, Caitlin, but I'm kicking this can to another elected body of medical professionals or more in their realm and just saying, I'm okay with opening this. I trust that you will make the right decision. I have no way of knowing whether or not the Board of Health is going to say, yep, the whole town can be free on the 28th of February. They may say March 7th or 21st. 21st to me, I believe, is the Monday immediately following the St. Patrick's Day Parade and the road race, which,
And then April vacation.
yeah, but I
Right
mean,
around the corner
a
as
vast
well.
majority of Southampton is going to be over there. And the other thing is we are the largest feeding family into Hampshire Regional, and they're dropping it.
Mhm.
So that's why I stayed with the date. You know, there's no guarantee it's going to happen on February 28th. I'm just removing the layer and pushing it to the Board of Health, which is why I picked that date.
So can I offer a amendment to your motion, John?
You can offer.
Well, can I do that now?
Sure, go ahead.
Okay, so I wanted to change the language to staff and students would not be required to wear masks except under the direction of nursing staff in order to allow for masking after quarantine periods and if they need to enter the nursing area in order to receive care.
I thought that was required already, but.
I think that's required under the DESI mandate
Yeah.
anyways.
So that's in there no matter what, I believe.
Yeah.
Right, the masking within the nursing station.
Yep.
The 5 days after, which is basically day 6 through 10, right?
Mhm.
Yeah.
And then on the school busing would still remain in place because that's outside of our
Mhm.
control at the moment.
But if they put it in our control, we would have to make another meeting and another thing in order to keep that in place. Whereas if we put it in our motion now, it would be included. And then
Just
we could,
add it in the wording.
It would, but we're also very good at having an emergency meeting in 24 hours. I mean, so I hear you. I'm going to decline to amend my amendment or amend the motion that way.
okay, can we put it to a vote for the amendment?
All right, right. So you've asked me to amend my motion. I'm declining to amend it. So you can make an amendment, and if it's seconded, we would vote on the amendment. So your motion is?
So the motion is to amend the language from masks are no longer required for students and staff to masks are no longer required for students and staff unless directed by the nursing staff to wear a mask for the purpose of completing quarantine on day 6 through 10 after their day 0 through 5 quarantine period and in order to receive care at the school.
I mean, I can second it. I think it's held anyways within the mandate. So I think that's outside of yeah, but I'll second it for voting purposes.
Okay. Yeah, it's like I said, it's under the current mandate, but just like we're having to revise our mandate now that the DESI mandate is gone, we would also do that then, and we would have a right or a chance as a community to reevaluate if we want to change that.
Right.
And so I'd rather have us, the authority be transferred back to us when their mandate goes away so that we can decide what's best for our community.
I gotcha. Okay.
All right, so there's a motion to amend the motion on the floor. It's seconded. The amendment is to include or to modify no longer required to wear mask in the building during school hours period, insert unless directed by the nursing staff, comma, for days 6 through 10 after testing positive for COVID or to receive medical attention. right? So we're going to vote on the motion to amend, and we're going to vote on the amendment to amend the motion. And we're via Zoom, so these motions have to be by roll call. Austin,
Rogers, aye.
Dylan,
Maudsley, no.
Allison,
Right on, no.
Julianne,
Tauscher, aye.
Lumber, aye. It's fine. Anything else on any other discussion on the motion before I call for the vote?
Can I amend? Can I amend the wording to say the date, March 21st?
Is there a second to the amendment? Okay.
All right, Stephanie, I tried.
All right. Any discussion? So the motion is to remove the Southampton School Committee mask mandate as of Monday, February 28th, 2022 at 6 a.m. On this date, students and staff will no longer be required to wear masks in the building during school hours unless directed by the nursing staff 4 days, 6 through 10, after testing positive for COVID or to receive medical attention. However, any member of the Norris community that prefers to continue to wear a mask is free to do so. Noted that any mandate in place by the local Board of Health shall be enforced. Norris shall remain closed to the public until April 1st, 2022. This topic will be discussed during the March regular school committee meeting.
So
hold on.
Elisa?
Elisa?
Yeah. Can you hear me now?
Yeah.
Should there be anything in there, and I know you haven't voted yet and it's part of discussion, but about that students would have to bring masks to school each day, regardless of which way you vote?
They have to for the bus too, though, don't they?
Right. So does that have to be in the motion? And so that it's part of the vote?
The way I envision this is we're reversing our mandate, and then administration should issue guidelines to the student body in accordance. If we could put it, Williamsburg put it in, right? But to me, that looked like putting policy into taking it away from administration, spelling it out. I think in order to achieve this, if you never know when you have to go to the nurse's office, you have to have the mask. So I would imagine that the school or administration would send out guidelines as they saw fit, and not to take it off the school committee, but put it back onto administration to run the day-to-day school.
Okay.
Dylan?
We need language. Oh, sorry, Dylan. Go ahead.
Sorry, Dylan?
Thanks. Can I propose that the motion be amended regarding the open to the public to say, except for those uses currently permitted? I'm just thinking of basketball. They're currently allowed to use the gym. I don't want to create a conflict there.
That's fine. Except for those already permitted.
Yeah, thank you.
Is there any language that should go in about administration has the right to change this mandate should they need to for an emergency basis? Just if they see cases go up and need to enact something while they're waiting for the emergency meeting to come up?
Right. So I think everybody read the Williamsburg motion.
Right.
So I saw that in there in contemplating that, but I guess in my mind, not having it in there, it's the superintendent. The superintendent has absolute authority short of a motion. So if the superintendent sees something that interferes with the safety and welfare of the children, she should just implement it and then notify us later, but she doesn't need our consent to do it. And if we object to it, the chair can call a meeting, or any single member can request the chair to call a meeting. I kind of linked it to the boiler goes out and it's 20 degrees outside. Superintendent's not going to call us and say, I got to close the school. She's just going to do it. So if all of a sudden there was a 300 case spike overnight, do you disagree with me, Dr. Bonneville?
No, I appreciate that.
Okay.
And so this motion doesn't affect any of the other mitigation strategies.
No, and specifically to address the association's point of view, which is why I added the April 1st, you know, one layer, the mask. And then we go a whole month, we get through the high holy days of Holyoke. And then we'll be out in April. And hopefully by April, the way the weather's going, we can have all the windows open, which is even going to be, you know, another layer of mitigation that we can have. So. If there's no other amendments, can we vote on the motion to see whether we have it or if we have to start from scratch? Okay. Allison,
Right on, aye.
Julianne,
Oh, sure, no.
Dylan,
Maudsley, aye.
Austin,
Rogers, aye.
and Lumber, aye. Motion passes. Is there anything else to come before us about masking?
I had a question about the Board of Health. If they were to vote to keep the mandate on, obviously we know that includes us, but is there any way that they're ever allowed to exclude a certain thing, like the mask mandates in place except for at the school, or is that?
I think so.
They can exclude things or they can't?
Others, I've seen other school districts or other communities do that in Massachusetts, so I don't see why not.
And just since it came up at school council, how this will affect sports, specifically basketball, the motion that we just made only applies to staff and students. And so the mandate still exists for visitors.
I think, Austin, the question was about MIA, right? So if they lift the mask policy starting on Monday, and we say we're lifting the mask policy, but it's contingent on the Board of Health, where does that leave us? Does the Board of Health still have power over MIAA or MIIA? I always get confused. So, you know, if they're coming into our building to play basketball, can we still say the Board of Health says mask or not?
I would say yes, the
Yes.
mandate from the Board of Health.
Okay.
Yep. Unless they modify the existing mandate that's in place or modify it, which is
So-
that pretty, Caitlin, is that pretty much your only topic Tuesday night?
Correct. We do have some other topics like ARPA funding that will come after that, but there will be time for a public comment, and then our priority discussion is surrounding the mask mandate.
And I didn't look at the posting. Is it going to be a Zoom meeting?
That's an in-person meeting.
In person?
What time is it at? Sorry.
5 o'clock. 5 o'clock. Sorry, it's a lot of
That's
meetings.
okay.
But as it stands, isn't MIAA makes regulations for athletes, not visitors, right? So their regulations would not say anything about our visitors. So still, under the scenario that MIA modified their recommendations, the Board of Health modified their recommendation or their mandate, they would still be mandated under our current mandate for visitors.
So right now, on March 1st, because this motion passed, on March 1st, if the Board of Health takes no action on the 22nd, all students and faculty have to wear a mask.
Right.
And so do the youth program that's in there on the weekends, the SYAA, right?
Yeah.
And as the layers come off, they can, but they're going to hit that bottleneck until the Board of Health does something. That everybody can release it, but if the Board of Health doesn't, then everyone's got to wear them. Okay. Anybody else?
Just to that point, I would suspect that if the Board of Health does lift the mandate, even though we do say visit policy is for students and staff, I think that applies during school hours. I think outside of school hours, that would be anyone using the building, permissibly using the building would not be required to mask. That would be my interpretation of it.
Right. And we certainly have time to visit it because the building's not going to be open until April 1st. we have our March meeting, and then we have 2 meetings in March already scheduled, where we could revisit this if need be. Okay, so if that's it, then Caitlin, do you want to adjourn your meeting?
Yes, I'd like to adjourn the Board of Health meeting, joint meeting with the school committee at 6:52 PM.
Thank you. Is there a motion to adjourn the Southampton School
Motion to
Committee?
adjourn.
Motion made, seconded,
Second.
all in favor?
Aye.
Aye.
Aye. Thank you, everyone. This ends the meeting at 6:52.
This government meeting is brought to you by Eastworks and our local cable subscribers.